Over the last 22 years of my practice doing pharmaceutical cases, I've worked on several claims involving drug reactions, and in particular one specific type of drug reaction. There are more than 400 known medications that can cause a condition called StevensJohnson Syndrome. StevensJohnson Syndrome is actually just one name. There's actually a spectrum of conditions. The other ones are called erythema multiforme and toxic epidermal necrolysis. And basically these are massive hypersensitivity reactions to a medication. And there's no way to know whether a particular patient is going to have a problem. There are certain medications that are more likely to cause these types of reactions, antibiotics and anti-seizure medications in particular. But there are patients that, with epilepsy, for instance, that have taken Dilantin for many, many years and never had a problem until they were given an antibiotic for an infection. And suddenly that was enough for that particular patient to have a reaction. Patients who are Asian and African American are also at a higher risk of having this type of a hypersensitivity reaction. And what happens, often you'll see a medication advertised on TV, or your doctor, when he prescribes the medication to you, might say, if you have any rashes, unexplained rashes, please call your doctor, kind of thing. That's really important information, because in the early stages of these reactions, patients often will have a very slight rash. And if they stop the medication at that point on the advice of their physician, then the process stops at that point. If, however, they continue to take the medication, that process, if it is Stevens-Johnson, can very, very quickly escalate. What ends up happening with a number of patients is their skin starts coming off and it looks like they've been burned. In fact, the patients end up in a burn unit often, or they have to be transported to a burn unit because they are losing large amounts of their skin, and they are treated just like a burn patient, even though there's been no burn experienced by the patient. Unfortunately, when you have a patient that has experienced that kind of an insult to their system, it actually can cause huge shifts in the fluid in their body, and so they can have problems with their electrolytes, which can lead to heart arrhythmias and organ failure. It has been reported that perhaps as high as 1 in 4 patients that have Stevens-Johnson syndrome will die from that condition, especially if it's not identified quickly. In addition to dealing with Stevens-Johnson issues in drug cases, we often are also dealing with it in a medical malpractice context within our law firm. And it's because the patients often appear at a rural hospital with classic signs of Stevens-Johnson syndrome, but the doctors don't recognize it as being such. This is a relatively rare condition, so a lot of doctors have never seen it before. And the fact that it is a rare condition is also a problem from the drug side as well. When new medications are put on the market, they're tested in a relatively small number of patients before they're introduced to the masses. It's not unusual for only maybe a few thousand patients to have been given a new drug before it's approved for marketing. The problem is that's under very controlled circumstances. When you take a drug that's only been tested on a few thousand patients, and then suddenly it's being taken by 1 million patients, all of different backgrounds, all with different medical histories, taking different medications simultaneously, you have the added possibility of developing adverse reactions. So what often happens with a drug that is causing Stevens-Johnson is that we don't know about that until usually the first couple of years that the drug is on the market. For a lot of patients, they say, what should I do? I wouldn't take any medication on the first 18 to 24 months that it's on the market, unless it's going to cure your cancer or do something just life-altering for you. Because it's usually within the first 2 years that we're going to see those types of adverse events. And there are some drugs that actually have been removed from the market, like Bextra, which was an arthritis drug that I worked on maybe about 10 or 12 years ago. That drug was removed from the market because once it was taken by the masses, that was the first time that they identified that there was a Stevens-Johnson risk. So I think, like I said, it's important for patients to be very cautious about brand new drugs on the market. And also, if they do develop a rash, that it be treated in a very quick fashion. I'm not saying stop the medication, I'm saying consult, call your doctor's office and honestly go into the doctor's office so that they can see it. Because it's one thing to call the doctor's office and have somebody tell you, oh, just put cream on it. It's very different to actually be seen by a healthcare professional who understands that you've just started a new medication, so that they can then assess whether you might actually have a Stevens-Johnson issue and treat it appropriately, which usually involves discontinuation of the medication and perhaps getting you to a burn unit if necessary.